Many people struggle to understand their medical bills and what they owe doctors. In fact, many medical groups struggle to understand their billing and what patients owe for services rendered. Sometimes this feels like it's by design. In this video, we consider your visit to an ambulatory surgery center or an ASC for a knee surgery. Let's call this a full ACL tear and meniscus tear. When you visit an ASC, usually an outpatient facility versus having a surgery performed in a hospital may own the center, a doctor may own the center, or it might be jointly owned by the doctor and the hospital, a joint venture. As a side note, if a doctor, in our case Dr. Smith, is a part owner in a surgery center, he needs to let you know so that you're aware he is making money by performing the surgery and by owning the surgery center. When you have surgery in an ASC, you'll generally get 4 bills. One from the doctor performing the surgery, Dr. Smith, one from the surgery center, called the facility fee, one from the anesthesia provider, and one for, let's say, durable medical equipment, such as crutches. 2 items not considered in the surgery are the pre-op visit to discuss your case and the post-op physical therapy for recovery. You'll receive separate bills for your pre-op and PT services. So Dr. Smith performed ACL surgery on you. All went well. You get a statement from Dr. Smith for his time and skill performing the surgery. He charged almost $18,000. Now, Dr. Smith charged $18,000, but he won't get paid that amount. Instead, your insurance company has negotiated a fee, or allowable, for Dr. Smith for this surgery, and that allowable is about $2,000. Thus, the difference between the charge and the allowable is written off, and the patient does not owe that. The same holds true for the other components of the surgery, like the facility fee, the anesthesiologist fee, and the DME. The reason you'll get 4 bills is because each piece of the surgery is considered a separate service. Even if the doctor owns the ASC, you'll still receive a separate bill because the ASC has a separate billing number or business ID with the insurance company. It's instructive to know, too, that no one in healthcare gets paid what they charge. We've covered this in other videos. As you can see in our example, after all the discounts, for example, contractual write-offs are taken, the actual cost to a patient is about $26,000. In our example, the patient is on an 80-20 plan where the insurance company pays 80% of the allowed amount and the patient pays the remaining 20%. 80-20 plans these days are kind of like unicorns. In our example, the patient's out-of-pocket costs, what they'll pay, is $5,295. But if you had a high deductible plan and had not met your deductible, you'd be on the hook for a lot more. This example is good to understand because many people are surprised when they receive several bills for a surgery. Also, many folks don't understand that they don't owe all that's charged. We'll cover an example in another video. Lastly, people should ask the surgeon if the surgery center is in or out of network. In-network means the owner of the ASC and the insurance company have agreed on a set fee, and this might save you some money. This is a very simplistic example, but as with our other videos, paints a directionally accurate picture of care delivery across the United States. Remember, CUBE's videos are not meant to answer all questions precisely. There's so many moving parts in the delivery of care throughout the country. Just remember, some nuance exists geographically. Healthcare really is local. If you have an idea you'd like to address, please subscribe, like, share, and if you have any questions, email them confidentially to questions@cubed.org. Stay tuned for our next educational video.